Who, when and where? We'll tell you all the details about vaccinating younger kids as bookings for the COVID jabs start tomorrow. Business as usual for the gym that was identified as Singapore's first suspected Omicron cluster. And Causes Week begins with a doctor who started a project helping others cope with grief after her personal story of loss. Welcome to The Big Story. I'm Olivia Quay. You can subscribe to the Straits Times channel so you never miss a single episode. The first paediatric doses of Pfizer's COVID-19 vaccine are expected to arrive tomorrow. And this means Singapore can start vaccinating children 5 to 11 years old in December as planned.
As parents, we all want to keep our children safe and healthy. Our children come into regular contact with family and friends as part of their daily lives. While the risk of our children being infected can never be entirely prevented, vaccination will reduce their chances of being seriously ill if they are infected. Many parents have been concerned about the disruption to school activities as a result of the pandemic. As more of our children get vaccinated, we'll be able to resume more activities, sports, and games, which are critical to their holistic development and well-being.
More details about this vaccination exercise that will cover over 300,000 children who are Singapore citizens, permanent residents and long-term pass holders, and it will begin with primary 4 to 6 pupils attending MOE schools next year. Well, these older kids can get vaccinated from next Monday, December the 27th, and close to 120,000 SMS invitations will be sent from tomorrow to their parents to book appointments. Then from next Monday, parents of all other children born between 2009 and 2012 not in MOE schools can register their interest. P1 to P3 pupils will be next. From the week of January the 3rd, their parents will receive booking invites, and this will be followed by all children aged 5 and above from the week of January the 10th. Well, this exercise will be done across 15 paediatric centres, mainly located with existing vaccination centres for adults and older children, but with separate queues for younger children to ensure correct administration of the vaccine. These spaces will also be manned by medical personnel trained in paediatric care, as well as staff trained in administering vaccination to children. 7 centres will start operations from Monday, followed by 7 more from January the 3rd, and the last will open from January the 11th. The full list of these centres will be uploaded at vaccine.gov.sg. I'm happy to have education correspondent Amelia Teng back on the show. Help us make sense, Amelia, of how these children are divided into batches, with older ones being able to get vaccinated from next Monday.
Yeah, so like you said, the kids will be able to get their vaccination appointments by broad age bands, starting the P4s to P6s next year. And then this will be followed by the younger ones, P1 to P3s next year as well, followed by the all children aged 5 and above. One thing to note is that you have to be at least 5 years old on the day of the vaccination to be eligible. And I think something else to note is also that, the children from the 2009 batch are included in this exercise. And some people have been asking why, because these kids would be turning 13 next year. The reason is that there's a small group of children who have not crossed their birthdays this year. So they are born on the 28th or 29th December, for example, and they are still eligible for the vaccine for the younger kids because they are still 11 at that point. So if you have a kid in this age group, you actually have the option of going for the younger vaccine for them at that age. But if you cross the 12-year-old border, then you can just walk into any vaccination center to get an adult dose.
I know, Amelia, we have talked about concerns that parents may have about getting their younger kids vaccinated. So now that we have more details about this vaccination drive, what are the parents saying?
Yeah, I'm sure that there'll be parents who want to get their kids vaccinated. But I've also spoken to quite a few of them who are choosing to wait it out and perhaps see if there are any reports of side effects or adverse reactions in the coming weeks. And some parents are hoping that actually they will have more options, like the non-mRNA vaccines to choose from. Some feel a little bit forced into it because there's only one vaccine available now. And even among parents who are not really against the COVID vaccine, there are still concerns about the safety and the side effects, given that this is a new vaccine and it's different from the traditional childhood vaccines that our kids take, because those have lots of years of data already. And one parent I spoke to said that he was wondering whether we are rushing into it so a bit too soon for the younger kids, given that they're not actually a high risk group, and they could have to live with long-term side effects if there are any. I think some parents are also wondering if the children would still be suitable for vaccination if they have other allergies or medical conditions like asthma. The answer from MOH is that if you have a general condition like childhood asthma, you should take the vaccine because you need the extra protection. But if you have a severe allergic reaction to the components of the vaccine or on the first dose of the vaccine, you shouldn't continue. And if you have any doubt, parents should consult a doctor about whether the kids should take the vaccine.
Well, Amelia, you touched a little bit on, the concerns surrounding side effects. So with these pediatric vaccinations happening when the school year starts and factoring in that, some kids may need some time to recover from the jabs as adults had to, should schools and parents then, come up with an arrangement to avoid a scenario where classrooms are half empty because, students are on MC at the same time?
I think actually the side effects from the vaccinations should not be too adverse for most of the children. But if it's necessary for the kids to have some recovery period, MOE has said that parents just need to inform schools that the child has taken a vaccine recently. And if you inform the schools, then the teachers can also help to keep a lookout for your child and perhaps sit out any physically strenuous activities for a while as well. And students who are getting vaccinated during the school hours and those who feel unwell from the side effects will also be given time off, and you'll be deemed to be on medical leave. So I don't think there should be any rush to also go and book weekend slots for the appointment. It'd be nicely spread out.
Well, Amelia, the Education Ministry says that while this vaccination drive, it would mean, quote, greater scope for us to calibrate some of these safe management measures to allow a wider range of school activities. What are some ways that school life for these younger kids can return to a pre-pandemic normal?
Our children have, had constant disruptions to their lives since COVID hit us last year. From not, being able to have normal PE lessons, recesses, learning excursions, outdoor activities. They've not been able to really run around and play freely in schools. I'm not sure exactly when school life will return to the pre-COVID normal that we know without the safe management measures, and that would very much depend on Singapore's approach as a nation. But MOE has said that, it hopes to allow students to have larger group activities and CCAs, for instance, like team sports in the near future. And vaccinating students would be one big step towards that. So, for example, schools are taking part in the pilot to allow up to 10 fully vaccinated individuals to take part in team sports. And this will apply to students as well. And personally, I hope that as we look to ease measures for the general population, as our vaccination rates and booster shots go up, we will also do the same for our children so that they could, have some good memories of their childhood and their school life.
For sure. Well, thanks very much, Amelia, education correspondent there, Amelia Teng. After being identified as a suspected Omicron COVID-19 cluster, Anytime Fitness in Bukit Timah Shopping Centre has undergone a round of cleaning and remains open. When the Straits Times visited this morning, only 2 people were seen at the gym. Staff were spraying and wiping down equipment with disinfectants. Now, some gym goers who only knew about the suspected cluster after speaking to the Straits Times said they will be staying away for the next few weeks. According to this Instagram story, the Anytime Fitness outlet said it was alerted to the cases yesterday and the premises will go through another round of cleaning. It also revealed that the cases had visited the gym at least 5 days ago. They were not part of any classes and had been doing their own training. Well, there are 3 cases linked to this suspected cluster. 2 have tested preliminarily positive for Omicron, with a test result of the 3rd case still pending. One case is a 21-year-old man studying at the At Sunrise Culinary Academy. He hadn't been to school recently. The other man is 24 years old and unemployed. The 3rd case is an 18-year-old Ngee Ann Polytechnic student who was last in school on December the 15th. All 3 are fully vaccinated and have mild symptoms. They had visited the gym between Wednesday and Friday last week. Overseas, Australia's Prime Minister Scott Morrison says the country is not going back to lockdown despite the surge in Omicron cases, insisting that limiting the virus's spread comes down to personal responsibility. Mr. Morrison urges authorities to shift away from a, quote, culture of mandates when it comes to masks and social distancing rules. Meanwhile, according to latest U.S. federal estimates, the Omicron variant accounted for 73% of all its sequenced COVID-19 cases, surging from around 3% last week. Delta has now receded to roughly 27% of sequenced cases. Separately, health officials in Texas announced it's recorded the U.S.'s first death related to Omicron. In non-COVID-19 news, Malaysia's former Prime Minister Mahathir Mohamad will be discharged from hospital within the next few days after being admitted for an unspecified checkup. In a statement today, the National Heart Institute says the team of doctors treating Dr. Mahathir is satisfied with the results of the investigations done over the last few days. And although in hospital, Dr. Mahathir today posted on his long-running blog, writing about global warming and warned of more natural disasters. Much of central Malaysia suffered its worst floods in decades following incessant rain over the weekend. Every year at the Straits Times, over the course of a week, we put the spotlight on individuals and groups making a difference through their chosen causes. They could be for the community, for children and youth, or for the elderly, or something else. Today, we want to introduce Dr. Chia Ling-Yi, her chosen cause, helping others cope with grief. Through her support network website called Before Beyond, she provides an online space for people who are coming to terms with the loss of a loved one. Dr. Chia, founder of Before Beyond, joins us now. Well, Dr. Chia, there is a personal reason why you set up Before Beyond. Could you tell us more about your own experience?
Yes, there is, in fact. The idea for Before Beyond started when my mom was diagnosed with terminal cancer. Initially, I was devastated by the news, but after spending some time thinking about it, I became determined to make this end-of-life journey together with her the most meaningful journey yet. Even though there were a lot of dark memories along the way, there were also many precious moments filled with tenderness and warmth that brought our family a lot closer to one another. I wanted to be able to share this experience of hope with others, that the diagnosis of terminal illness and everything that comes after is not a journey filled with doom and gloom, but an opening for love and dedication.
That's a really nice thing to say, and it seems that you have made your peace with, the loss, which we are so sorry to hear about. Well, Dr. Chia, how has creating Before Beyond helped you cope with the grieving process, and could you share more about the response you've received?
Well, don't feel sorry at all. Pouring my thoughts and lessons into Before Beyond has given me the opportunity to process my grief and make sense of it all. Why does it hurt so much? Why do we cry? Why does grief come gushing back at the most unexpected of moments? Even though the website has only been up and running for about 10 months, the response has been a lot more than what I expected. I've had the privilege of being able to connect with people who have experienced different kinds of losses, but who all understand in their own way the pain of losing someone or something that they love.
In relation to the response that you've gotten, do you have plans to expand the initiative in order to, reach more people?
Well, yes, definitely. I think that there's so much more that can be done to bridge the gap between professional knowledge and real and practical on-the-ground application in our everyday lives as human beings who need time and space to hurt and heal. So definitely, I hope that Before Beyond can expand and continue to evolve to provide that space for people.
That was Dr. Chia there, founder of Before Beyond. All this week, the Straits Times will feature stories of individuals and groups who are making a difference through their chosen causes within the community. You can find them at the website below. Visit straitstimes.com for more news and our YouTube channel for more videos. Subscribe by hitting the red button below. I'm Amelia Teng. See you tomorrow for more stories on The Big Story.